And I'll let you know what's in store tonight as well before we get going and the areas that we'll be covering. Okay, it looks like YouTube's quite busy tonight, as it might be on a public holiday. The bandwidth here in Portugal, very leisurely, or it's a leisurely evening. I'll let you know what's in store tonight. The bandwidth is being used. Okay, there we are. We're definitely live on YouTube, and it is my great pleasure to welcome Nuno Mendes from Winsurance tonight to this webinar from Expats Portugal, Optimising Your Healthcare in Portugal, Public and Private Healthcare. How are you doing, Nuno?
Hi, once again. I'm good. I'm good. Thank you for having me, and prepared to start the presentation.
Excellent. And in this presentation will be included the following points so that you know this is what we'll be covering. Who's entitled to free healthcare? Free versus paid service, obviously the public and the private systems. So who's entitled? What are the pros and cons of the free, respectively free and paid for services? Example costs of the paid services, and we'll have some examples. Obviously, they won't be quotations, but will be ballpark figures. So you'll get a sense of what you'll be up against here in Portugal, paying for healthcare, which I suspect will be a lot less, for example, than those in North America. And we'll let you know exactly how you can get in touch with Nuno and his team to get a quote and to make contact with Nuno and team. And from the team tonight, Sandra and Ruth are here as well. Thank you for being here this evening, and they'll probably be taking care of you behind the scenes in the chat as well. So over to you, Nuno. I think you have a bit of a presentation for us first, and then we'll have a few questions with you thereafter.
Yes, I have a presentation. I have changed a bit the information provided through the presentation. So instead of be talking about insurance plans and detailed coverages, I will be providing you information to allow you to decide on the accurate plan. So is there any optimal plan or not? So start sharing. Let me just try to share.
While you're bringing your presentation to the screen, we can say a few more hellos. We will deal with age limits or levels as well. We'll make it specific to age. So thank you for the prompts on that. Beautiful day, says Laronda. Beautiful in big capital letters here on the California Central Coast. Good evening to you, Laronda. Good to see you here. Jose Mario, bon dia a todos. Bon dia to you as well this evening. And we have some other messages as well. Vitamin D levels. Yes, was outside getting in some vitamin D, but had to come in to watch this. Sorry about that. Take it outside on your tablet. I might learn something, but it is watching this presentation bad for my vitamin D levels. No, I would say switch to the tablet, as in your digital tablet, not the medication tablets, and pop outside and carry on getting the vitamin D whilst listening to the webinar tonight. And wow, look at this on the screen. Nuno, you've excelled yourself this evening.
Are you allowed to see my presentation or not yet?
It looks like Minority Report suddenly. You look like Tom Cruise in Minority Report with this great screen behind you with all the data on it.
But can you see the data? The
yes, we can. Yeah, definitely. You're zooming in and out of various screens.
Okay. Yeah, Thank you so much. So we'll be talking about healthcare in Portugal. We'll start talking about the two systems that we have. The optimal health insurance, optimizing the healthcare experience, and who could be your partners on healthcare. So the two systems, yes, we have the public, and the public is the SNS. It's how we refer to. When we talk about private, we always talk about insurance. And I'm doing this differentiation because some of you start talking with us about the national insurance or the public insurance, just to be allowed to be on the same page that when we talk about insurance, is always private. Okay. Talking about insurance is also talking about the insurers and the network providers. We'll come back to this theme later on. And it's important to understand that there are regulators on the market. The SNS is a Portuguese government priority. So I believe that this is an important information to everyone that is thinking on moving to Portugal. Sometimes the actions don't are so strong as the words that the politicians keep saying, but it's a priority, and I don't have doubts about this. For instance, and I believe that this was settled last week, that the government has this program, OncoStop 2024, due to the huge delays on oncology surgeries. They set a specific program doing priority to surgeries to the oncologic disease or oncologic patients. So if we have a public system, if it's a government priority, why private? So the public system provides you some apps that you can see on the left of the screen. This allows you to navigate on the public system. Also, in the center of the screen, you can see the waiting times of each hospital on Portugal mainland. You can search, you can filter. For example, I filter for oncology hospitals, and we have 3, just to know that we have specialized public hospitals dedicated to the oncology disease. And here, this is information from this morning, and this is regarding consultancies on the emergency or urgent service of the hospital. So you have Hospital Santa Maria in Lisbon and Hospital São João in Porto, and they stratify the information regarding how urgent is the appointment. Once again, this is not surgeries. Through these, on the center of the page, you can, when you pick up one hospital, you also can access to surgery waiting times, okay? But now I'm talking only to give an example about waiting times to doctor appointments. So below you have private hospital in Lisbon and in Porto, and the difference is huge. This is a good day at the hospitals because on Hospital Santa Maria on winter times we easily have 24 hours waiting time to urgent, so the yellow urgency, it has 24 hours waiting time instead of 37 minutes. And this is one of the advantage of the private, which is a much lower waiting time. We can get an appointment on the same day, and the availability of the doctors. Just as an example.
Mm-hmm.
So is there an optimal health insurance? Maybe we need to start looking to the statistics. So health is a transitory state. Yes, I'm good today, but I don't know if I will be in the following second. Past records don't ensure future events. And I'm mention these because often you said, oh, I've been healthy all of my life. And I can assure you that we have plenty of examples that people that have been healthy, suddenly something huge hits. So think on this. And has an example, and once again, based on statistics, 50% of the claims, this is information from one of the insurers that we work with, because we work with almost all of the main insurers in the Portuguese market. 50% of the claims occurs over 65 years old. Thinking that we have like more 15 years of life or 20. So 50% takes 50 years old to be used, but the remaining 50 happens on the late 15 or 20 years. And this is why one of the reasons, the main reason why the insurance premium rise a lot over 65 years old. We need to think that today's medicine and today's technology is much, much better rather than 5, 10, 50 years ago. And also much, much more expensive. So we cannot expect having a decrease of the insurance premiums, but the reverse. The two factors that influence claims are the frequency of the claims and how expensive they are. And of course, this has an impact on the insurance premiums. But we can think that we are talking about the private sector, but this statistic is about the SNS, so the public sector. So the SNS global expense rise 21% between 2019 and 2022. Some medicine, the overall medicine rised 12%, and some oncologic medicine rised 40% in 2022. Good news, 2/3 of the medication is funded by the Portuguese state. Emergency service have a very good service level, so we can count on this. Is the 112, so is the equivalent to the 911 that we know in US. And the other good news is that governments keep saying that the public healthcare is a priority. So on the private sector, the insurance premiums keep be pressured to rise. But also they keep investing on new hospitals, equipments, and personnel. And in Portugal, the public, the state, so the public system, look to private sector as an extension of the public, and sometimes they work together on this. So, what are the guidelines that we need to look at to decide which is the optimal insurance premium, the optimal insurance policy? So, insurance, any kind of insurance is about managing risk. Point. Only this. What we hope is pay the premiums and never use the insurance policy. Okay, let's to be clear, all of us. We need to be aware about the trends. So how age influenciate claims. We have talked about this. The need treatments and techniques, the expensiveness of the healthcare, and some disease happen more frequently, like the oncologic disease, and all of these influenciates the cost of the healthcare. Knowing this, we can start looking to coverages, limits, copays, and so on, and also the insurance premiums. And we have some examples to you. So we look to the statistics, and something that all of us love to do is Google, okay? And when we Google, we are masters on everything. So good news, for example, this bank offers an insurance plan for 35 cents a day. This insurer offers an insurance policy for 7 euros a month. This one for 5 euros a month, even better. And this is a comparator of the market that offers an insurance plan for 100 euros. Yeah, but what I'm really getting for this money? This is the question. So yeah, Google, do some search for yourself, but then go deep on this. And these are insurance premiums, accurate insurance premiums, to the ages of 44, 64, and 84 years old. Okay. For different plans, the the basicest one to the most complete, and you can see how the insurance premiums differ. So yeah, Google, do the search by yourself, but be aware that you need to compare apples with apples. Otherwise, you could discover too late that the decision was not the best one. So our suggestion is be rational and do questions. This information is public information from one of the private hospitals in Portugal, okay? About how much does the healthcare could cost. And I have separated inpatient care of outpatient care. So daily stays can cost 400 euros, and appendicitis surgery is 9,000 euros. Chemotherapy, it depends on the kind of the chemotherapy. It starts in 50,000, but if the chemotherapy treatment is the newest, based on the DNA that is different from each person, it could cost from 200,000 euros to 400,000 euros. And this is important to think about what is the limit that you want to have in your insurance policy regarding inpatient, okay? When we think about outpatient care, we are talking about doctor appointments, exams, and treatments, basically this, okay? And when I say treatment, exams, I include blood tests. So a doctor appointment is not a big thing, 100 euros, 130 euros. An echo, 300, some MRIs, 900. But there are this specific exam of PET could cost 2,500 euros. And knowing that the outpatient coverage usually has much lower, not usually, always has much lower limits rather than the inpatient, you need to be aware and take care of what you want regarding the coverages, the limits, the copays, territorial scope, and so on.
So can I just jump in there a minute, Nuno?
Yeah,
So
please.
with some of the prices that you've quoted there, you've put them in there so that people are aware that these might be exclusions, and that's a reason why the insurance might seem very good value or cheap. But when you look at the small print, some of these things that you might, God forbid, need are not included, and you find yourself up against quite significant costs.
Yes, that, and also because we have a formal health insurance policy covering you properly, and we have discount plans that basically covers mostly nothing. What provides you is a discount on certain healthcare networks. So you will be paying by your pocket for most of the cost.
Yes.
So when we reach this point, we could think, oh, so I'm in this point, I can decide about the optimal insurance policy. But there are a big but. You must know about the wording of each health insurance policy that you are comparing. Otherwise, you will be doing a huge mistake, okay? Because they are very different. Once again, the suggestion, do questions, okay? For example, for instance, can the insurer cancel the insurance policy on each annual renewal date? Can the insurance policy differentiate my insurance premium based only on the claims that I have made? And the answer is yes. Okay, basically yes. On most of the insurance, yes, they can cancel. They can appraise your insurance policy as much as they want. So usually people never ask us about this. They are not aware of this. Okay, if I have 30, yeah, I can play with insurer and do insurance policy, but if I start entering in late 50s, oh, I don't want to play with insurance, okay? Other points to take into consideration. Most all of the insurers have disease excluded on their wordings, okay? Almost all of them exclude pre-existing conditions, exclude congenital or malformation conditions. This morning, a customer called me that and they are in the 60s. I don't remember the age, but I believe that they are in the 60s. And he did an exam, and they discovered that he has a malformation with 60. I discovered that I have malformations on both knees when I had 40 years old. So
Oh, these
don't
are
think,
genetic predisposed
yeah,
conditions for
yes, yes,
that you
yes.
discover later in life as this person.
Congenital or
Yeah.
just malformation.
Yeah.
Okay.
Okay. Yeah.
So, because usually we assume that this is something that we know when we just born, but it's not true. Okay. Also, war is an exclusion, mental disorders. So all of these points, usually they are excluded in most of the insurance, not in all, but on most of them. So we have talked about the optimal insurance policy. So there are no optimal insurance policy. It depends on each of us. Okay. But what about the experience regarding healthcare? So very important is to know to navigate on the system. And as you know, we have the private and the public. Okay. Also, we have the insurer and we have the healthcare network. The insurer is the entity that has the contract, the insurance policy contract, and pay the claims, and have the exclusions and the wording and all of that. And the healthcare network is the healthcare provider. Simply this, that work together with the insurer. We know that this is some that worries you when you didn't move yet to Portugal, which is how I find a doctor. If I need a specialist, who I need to call. This is pretty easy because in Portugal, we usually, when we have a health insurance policy, usually we go to the closest private hospital, okay? And if we are okay with the doctor, usually the general practitioner, if we need a specialist, he or she, they will be the one who will tell us who is the specialist that we could visit. Or they gave 2 or 3 names, usually in the same hospital. So once into the hospital, we are simultaneously into the system. Okay. Yes, of course, it can happen that a doctor that has part of the healthcare network on the next year could not be, and the reverse, a doctor that is not part of the healthcare network and that I'm paying from the full amount, the next year he or she could be part of the healthcare network. So these contracts usually change on the end of each year, but they are pretty stable. But the idea is once into the system, I'm okay. Public or private, so are complementary. And we need to think that pharmacies work with prescriptions, no matter if they are from a public doctor or a private doctor. And the prescription has a QR code, and the QR code commands if the medicine is funded by the Portuguese state or not. So if the doctor be private or public has nothing to be with the amount that or discount that you will get on the medicine. Concierge advice. So there are some entities that they do the concierge advice. First, we need to know who is advising, and something that you can do by your own, because this is public information, and I'm talking about the regulators, okay, is that the entity Ordem dos Médicos, the College of the Doctors, every doctor in Portugal must be registered there to be allowed to work in Portugal and to have a professional liability insurance policy. What you know is that every doctor that is part of the healthcare network, they have checked this already, so we don't need to check this. But if you attend to a doctor that is not part of the healthcare network, I recommend to check, because we have news every year from doctors or from people that are working as a doctor and that they are not really a doctor. So take care with this. Also, about knowing the system, no one fully knows all the doctors in Portugal. So the best lead is your general practitioner from the private hospital guide you along the process and telling you who should be the specialist that you need to see, or the exam that you need to do. Regarding comfort, there are apps, some we already saw in the beginning, but also hospitals and the insurers, they have apps, and they have phone consultations and video consultations. So for minor things, as a flu, you can have a video appointment from your coach, and the doctor will send to your mobile phone the prescription, and you only need to go to the pharmacy and get the medication. Okay, so this is something that also optimize the experience regarding healthcare in Portugal. About the partner, choosing the partner. Okay, once again, do questions. Please do questions. Doing questions, you can evaluate if you tuned with this person or with this entity or not. Sometimes it's not a question of being good or not, professional or not. We just tuned or don't tuned with that person. But do questions, because you can evaluate if they are knowledgeable, if they can support you, what kind of support they can do to you. Yes, Google and check who they are. Check if they are reliable entities, brokers mostly, not the insurers, because all the insurers they are highly regulated. So I should say that the insurer itself is not for me a concern, but the contract, the wording, yes, is a concern. Okay. Do this entity empower you or disempower you? Do they do the extra mile for you or not? So evaluate all of these. Check Facebook groups to evaluate who they are. This is something that we in insurance we have, you can access from our website. So it's a kind of the extra mile regarding information, how to get the SNS number, the social security identification, and so on. So not big thing. Also to check for doctors legally authorized to work in Portugal. So we have plenty of information. What we can do for you, insurance, what we can do regarding health insurance. So we are fully independent from any insurer. So when we provide the information, it's like a consultant information that it's free, okay? You don't need to pay for the information. We work in collaboration with insurers, so we work as an extension from them. This is why sometimes you quote directly on their website, the insurer's website, and you get a higher insurance premium rather than quoting it with us, because we were working to the insurers and doing a lot of their work. We have an English-speaking team. We spend a lot of our time nowadays checking for hospital mistakes regarding bills. This is something that we really need to be cautious about, because I don't want to say this, but I feel like some private hospitals are just trying to get advantage of us customers. And even that we have an insurance policy, they are charging us fully. Okay. But it's important that you know that all the hospitals, all the healthcare providers have some procedures, and they are based on a direct phone line to the healthcare network to check if you have an insurance policy or not. Okay. So sometimes they say, oh, we are without the system, so we need to charge fully, and then you request to reimburse to the insurer. This is not correct at all. Okay. We are also limited regarding the information and the actions that we can do in your behalf, because hospitals are not allowed to give us personal information from you. So we have a restricted data protection, in Portuguese, RGPD. We have an omni-channel way to contact us. So we have plenty of ways that you can reach us. Something that I love is that we humanize technology. So yes, we have all of our work up on digital and technology systems, but we really like to have the conversations to fully inform you. Otherwise, it will be only a quote and we will lose a lot of information. We are a reputable insurer. That's why we are invited from insurers to participate on the development of the wordings, on the development of new products. And also they are open to tailor some products with us, which we have for you. For example, the mandatory travel insurance to the visa process. Regarding we work with all the insurers, okay, but regarding MGN, we are really the first broker of them. They have started in our offices in Lisbon from 8 to 9 months. So we work with them. We have worked with them on the development of the wordings. So we have a strong bond with them. Regarding checking us, this is from today. So we have this record on Trustpilot. And now please do all the questions that you have, because we love to clarify you.
Thank you, Nuno. Great presentation. Really very helpful and beautifully done, design-wise as well. Best of both worlds there. You've taken us over and above the world of PowerPoint, and for that, I thank you.
Thank you.
Sincerely, right. And well, I won't keep the recording going on for too much longer, but I would like to add a further comment here, based on my perspective as a foreigner and working with a lot of other people who are as well, and their excellent experience of you. One of the pitfalls, I think, and we've got somebody I think who knows a thing or two about marketing in our community tonight, talking about the 3 pillars of marketing: cheap, fast, and good. I think the other thing, when you're a foreigner, the other thing that you really want, and why people buy cheap insurance, is you want the pain taken away. I don't mean medical pain. I mean the relief of just ticking a box to say, okay, that's done now. That's out of my hair, what little I have left of it. And that is an error. That's a mistake, to rush into something because it just ticks a box. Because as Nuno's pointed out there, you can be regretting your decision long after the heat of that moment. So it is worth asking the questions. It's definitely worth doing all the due diligence. It's worth talking to Winsurance and going through the policy, and they'll do that with you. You know, you're like a concierge service in many ways, and in the support that you give to people. And I think it's really important not to rush into these things, just to underline what you're saying, because of the sense of urgency we have as foreigners to just get it sorted and then forget about it. I think it's really important to take your time with it, very much so with this particular aspect of moving to Portugal. So thank you for what you said on that. Jose Cruz, also very helpful behind the scenes, and some interesting comments on the public health system, speaking about how the staff are compassionate, but the resources are in a dire state. And I think you've addressed that as well, Nuno, and that's why you have this optimization approach to get the best of both worlds. And I think that's happening all over the world, to be fair to medical systems around the world, and it is happening here in Portugal, and that's why it's important to go for the hybrid system. I think Sandra has been working very efficiently behind the scenes, helping people. Thank you for that, Sandra. And on the issue of translating documents and contracts into English, Winsurance take care of that, as well as you've been saying to Debbie, who was keen to know about that. Behind the scenes there. So I'll pause the recording. There's no Dream Team session tonight. We'll talk to Nuno now about your specific questions as premium members here on the Zoom call. And we maybe go into dental, into optical, some of the other areas we haven't spoken about so much. And we'll get some specific examples for people, not quotes necessarily, but ballpark figures for those people who are here with us on the Zoom call. And thank you for the time being, Nuno. That's been superb. And we'll go to a few more of the personal questions now. And thanks, Sandra, as well, for the work you've been doing behind the scenes. All right, let me just pause that.